So the whole bait and switch conundrum that chiros talk about, I think it's people are looking at it from a different way. I used to be a purist, or I guess still I am, but I just look at things differently. A subluxation-based chiropractor, adjust the spine, it's going to help everything and that's I still believe that. But I realize that the general public doesn't think like that. So if you're a subluxation-based chiropractor, purist chiropractor listening to this, you're going to be talking to about 5% of the population or even less. We know this the average is about 10 to 15% of the population uses chiropractic. Of that are true wellness, looking for subluxation based, remove the interference of the nerve system. It's probably even less than that, 2, 3, 4%. And you're vying for that, and you're competing for that against others that think the same way. And what I've always thought was I'm sitting there in conferences year after year and listening to people talk about what about that other percentage? How do we open up to that percentage? And I realized we've got to talk their language, right? And so do I want to talk to the 3%? I don't want to talk to just 3%. I want to talk to what I think the middle, let's say 5, 10% of people see chiropractors. Well, I want to talk to the middle 20, 30, 40% that don't know, but maybe need some introduction to the chiropractor, build some trust and that kind of stuff. Now we know the other 20, 30% at the other end will never see a chiropractor, ever. I don't want to talk to those people either, right? I want to talk to that middle 30, 40% that don't care about subluxation, don't know about subluxation, don't want to be educated about it, but have some type of pain and dysfunction that need that relieved in order to open their mind up to learn how they got better, why they got better, and that kind of stuff. And some people may never want to know. So this is why I changed my tune on how I talk, how I advertise, and how I changed my office to having modalities and also a physiotherapist, because you open up the ability to talk to that middle 20, 30%, 40%. And then when they come in, people don't like the term use them bait and switch. Oh, you're bait and switching them. No, we're not. We're talking to them about their shoulder pain. So you have to, if you're a purist subluxation base and you don't want to do this, then don't do this. But if you're subluxation based going, yeah, we help shoulders and I've got the tools to do that, then why not talk to them about their shoulder? Talking about their shoulder, for example, yes, you examine the spine and you give them the program of care that includes all of that, right? A bait and switch would be we run an ad for shoulder, but we're not going to help your shoulder. We're going to just do something else. That's a bait and switch, right? Yeah, we don't do that. We bring people in for a shoulder and we have shockwave and laser. You don't want to do that. Like I said, you can't do this, but you have those modalities or acupuncture, or if you're good at some soft tissue, then let's bring them in, examine the shoulder, give them what the shoulder issue is going on, but then also teach them, hey, there's this whole spine around their shoulder that's not lined up properly, putting pressure on nerves affecting it. So if you really want to correct this, we need to look a little bit broader. That to me is not a bait and switch. That's just giving them all the information. And what you've done there, you've taken that middle population who have never would have come and seen you, is now coming to see you for a condition, but now opening their mind up to, hey, this could be coming from the spine. And guess what you have to do to that patient time after time? You have to educate them. You don't have to, but you'd like to educate them and drip information so that they understand, oh, the spine probably is causing this. So that's why I switched my tune in approaching marketing, talking to patients, advertising, those type of things. I changed also my office so that we accept that middle 2/3. And then I won't say convert them is not the right word. We allow them to discover that their spine and nervous system need to be checked and adjusted. So another example, if you don't have a device or a modality, think about an ad for sciatica. Now, nobody wants to put true subluxation-based chiropractor does not want to put an ad out for pain. But again, pain is a motivator. People are motivated by pain. Whether you want to do it or not, that's up to you. But I have no problem advertising for sciatica and for pain, examining them, telling them the source of the pain, getting started. Now, do I have to bring my subluxation-based approach and pummel it into that patient and just hit them with it in the first 2 visits. Yes, we'd like to convert them over time on how they think about their spinal nervous system. Headache's another one. Yes, I'll advertise for a headache. It's going to be much more advantageous advertising for headaches than it is advertising for a spinal exam. Because people don't know about it. It's our own fault in our profession, but they don't know that stuff. So I'd rather advertise to a headache. Yes, I know we're not treating headaches, we're treating the spine. That's great. That's semantics. That's things the population don't really care about. They care about their headaches and they're motivated by it. Now, once they're in your office, you can start to educate them and inspire them around the whole reason why they're having the headaches. And how you educate people generally is around asking some questions, right? Why do you think the way that you do? How do you think about this? Where do you think these headaches are coming from? But you can't ask those questions. You can't educate them if they're not in your office.